So our next speaker is Dr. Rachel MacCann, and if I can just briefly talk about Rachel, she is an infectious diseases registrar and ICAT fellow based in St. Vincent's Hospital, currently undertaking a PhD investigating the impact, and I'm going to read this carefully because I'll probably get it all wrong, the impact of inflammation and ageing in HIV, with a particular focus on the role of the gut microbiome. Brilliant. Okay, now possibly more relevant for this session, she is the co-founder and operations officer of the charity Irish Doctors for the Environment, which Philip mentioned once or twice. And in that context, she works to promote sustainability in healthcare to build a climate resilient and equitable future for our health system. So very much looking forward to your remarks, Rachel. So over to you.
Thank you very much for that introduction, and it's really lovely to be here today in person and together with the EPA, the HSE and the ESRI to deliver this very coordinated message today about health and the environment. So I'll be representing our charity Irish Doctors for the Environment today, and I'll be talking to you a little bit in more detail about some of the health impacts that we will face in the coming years in relation to climate change, and also how the health system will be impacted. And I think that what I'll talk about today will mirror what we've heard already from Laura and Philip. So first of all, Irish Doctors for the Environment. Well, IDE has this lovely dual meaning oscéige, meaning thirst or thirst for knowledge. And this ethos really underlies a lot of the work that we do. So our main aim as a charity is to promote education amongst healthcare workers and the public about the health impacts of climate change. And we do this through the 4 different pillars of education, advocacy, change and science. And I suppose, who are IDE? Well, we are formally a charity since 2020. We were founded in 2018, and we're composed of a committee of about 11 committee members and 11 working groups. And we're a body of different NCHDs, consultants, GPs, allied health professionals and surgeons. And really, we cover a lot of different groundwork through our different working groups. And through these different working groups, we take action in different projects specific to different aspects of healthcare, some of which I'll touch on a bit further. But these include active transport, anaesthetic gases, which we've already heard about, healthcare waste and sustainable diets. And really, we promote a lot of these actions through different awareness campaigns in social media, publications and journals. And we also engage a lot with different policymakers and healthcare decision makers to try to enact these changes in our healthcare system. And so hopefully we'll grow and expand on this as the years to come, and especially with the different working groups within the HSE strategy. And so first of all, I suppose, why doctors? And this has become more topical in recent years, and since the 2015 Lancet Countdown report, which did actually claim that physicians have a primary responsibility as leaderships and being leaders in our response to climate change. And I think that this is in part due to the ever-expanding role that doctors now face. We often find ourselves in a very privileged position to be the voice of policy development in public health strategies, in education, and also in now climate mitigation. And I think this enables us to be a voice of reason and advocacy for our patients who maybe do not have an active role in some of the decisions that are being made for them. And when we look at all these different healthcare impacts of climate change, it's very easy now to understand how important healthcare workers are impacted and have responsibility when it comes to climate change. And this can be due to effects of weather, heat, food, water supply, and infectious diseases. And I'll touch on a few of these in a bit more detail as I go along. I've mentioned this term before, and I'm sure maybe you're aware of the term planetary health, but this term came from that same 2015 Cancer and Lightdown report. And it really proposed a very new and very apt way of thinking about climate change, which focused on the health impacts and really underlies how our Earth's ecosystems disruptions will impact not only our health, but our planetary health. And by refocusing our train of thought on what we look at when we think about climate change will actually help us enable to deliver more solutions-orientated approach to climate change. And as mentioned earlier, healthcare has a significant impact on carbon emissions. And indeed, if the healthcare sector in entirety in the whole world was considered a country, it would be the 5th largest emitter on the planet. So this, although it's a worrying figure, also offers a huge opportunity for change. And so, well, why Irish healthcare? We've been responding in different areas in the past, and there's been a lot of efforts that we've conducted over the recent years, as Philip mentioned. But even if we just look in the last 12 months alone, we've seen various different consequences in the Irish population from climate change, both directly and indirectly. We've just emerged from a devastating pandemic that was caused by a zoonotic spillover, but also accelerated by globalization, and that shouldn't be diminished. We've seen a rise in human displacement worldwide, both through the Ukrainian war and recently through the flooding in Pakistan, which has seen over 10 million people displaced. And indeed, over the next 30 years, we anticipate that 30 billion people will be displaced. Nutrition is an ongoing concern, particularly through the access of the food supply chain and our ability to be self-sufficient in our food delivery, and also through heat waves. And I'll touch on this further, but we've just seen quite a devastating global heat wave this last summer. We're also about to enter a worrying kind of winter with an energy crisis, which will probably put more vulnerable people at risk of heat-related illnesses due to poorly able ability to heat their homes, and this is a concern for many Irish families. So I'll talk again now about these specific health challenges, how they relate to Ireland, what we can do to maybe address it, and then how this will impact the healthcare system as a whole. So as I talked about, this last summer saw a very worrying and unprecedented heat wave, both in Europe and worldwide. Indeed, the kind of highest temperatures we saw in Europe were in Portugal. And early figures actually from the UK showed that just in that summer period alone, they saw an excess death of 2,800 deaths in the over 65s. And I actually saw a journal.ie article yesterday which claims that about 15,000 deaths in Europe over 65 could be attributed to heat waves. And this kind of mirrors previous data from the earlier heat wave in 2003. Studies in France showed that in that elderly population, they saw about 15,000 excess deaths. And these are directly related to heat. As well as mortality, we're also seeing a burden on different diseases. In the last 10 years alone, we've seen a double in the figure of melanoma cases in Ireland, and this is expected to rise. We also see an exacerbation of those with underlying chronic illness, particularly cardiovascular disease and renal disease, which is putting those that already have a huge morbidity of underlying conditions at greater risk. And then finally, I think what maybe sometimes we forget about is how heat impacts our delivery of our healthcare system. For instance, some medical equipment won't work in extreme of heats. The AED machines or the defibrillation devices, if they're in extreme hot or cold, they won't work. Heat also impacts our ability to store and utilise medications, and particularly antibiotics and insulin. We've talked about this earlier. Air pollution, I think, is a very widely discussed and tangible consequence of climate change that I think a lot of people do understand and recognise. As mentioned earlier, Ireland does have pretty good air quality, and that EPA report from 2021 does show that we are meeting the EU guidelines for particulate matter and nitrogen dioxide, but also these do not necessarily meet the WHO health quality guidelines. And I suppose this should be our focus when we're thinking about air pollution, because air pollution both directly causes about 6.4 million deaths per year worldwide. And this can be a consequence directly on multiple different types of healthcare consequences. In the young children population, it's exacerbation of asthma and childhood respiratory illnesses. Then as we get older, it's impacting cardiovascular disease, increased incidences of stroke and COPD. And then also worryingly for pregnant mothers, it impacts the weight of their newborn infants. And so as well as, I suppose, the different health implications of air pollution, about 95% of the deaths that occur from air pollution worldwide do occur in developing countries. But as we see here, it does impact the morbidity and mortality of chronic diseases as we age. And actually, there was a systematic review just published last week, which showed that for every microgram per cubic meter increase of particulate matter, a person's exposure puts them at a 3% increased risk of Alzheimer's. So really, it has a lot of different knock-on effects depending on the circumstances and depending on our ages. As well as health impacts, though, it does have a financial consequence for healthcare. And I think Irish figures from the DCCAE show that air pollution has an impact of about €2 billion on our economy and about 382,000 working days lost per year. But Counter to that, the World Bank had a recent report which showed that for every 20% increase or improvement in our air quality has about a 16% increase in our workforce response rate and a 33% increase in productivity. So by causing positive changes, it has both a beneficial health impact but also economical one too. Mental health, we've talked about, I think, earlier today, I think is a really important and probably under-discussed area or consequence of climate change. And this, though, arguably can probably affect more people worldwide from climate change than some of the other ones I've talked about. And this can be because of both direct, indirect, and long-term outcomes of mental health. The more immediate consequences from, for instance, weather events can be much more easier to understand. We can see people experiencing anxiety, depression, and PTSD from the immediate weather events such as flooding and extreme storms. For instance, actually in the Hurricane Katrina in 2005, in the aftermath, they found that suicide and suicidal ideation more than doubled. About 1 in 6 people met the criteria for PTSD, and there was a 49% increase levels of anxiety and depression. And that was just from one extreme weather event alone. Some more longer term impacts on mental health can be, again, PTSD, mood disorders, and this can be due to kind of a combination of a complication of factors. For instance, people experience loss of land, loss of livelihood, and I think of farmers when I say that, due to the changing landscape we face, and also from human migration. We also see changes at a community level, and we are seeing a rise more in other diverse populations of interpersonal and intergroup social aggression. And this can also impact how we see ourselves, our social identity. And when you lose your livelihood, your land, your country, that has a huge toll on our mental health. And as ever, we always see that those who are disadvantaged, and in particular Indigenous groups, are the most vulnerable and the most impacted by these changes. So clean water, I suppose, is fundamental to every aspect of human life. And as mentioned, Ireland's water quality is showing a worrying downward trend in recent years, and primarily due to runoff from phosphorus and nitrogen waste from agriculture. And this, again, is expected to increase. We know we're facing more extreme weather events in Ireland. Just even earlier this week, there's been increased floods in Cork and many different parts of the population. And this impacts both the water quality and our health. There are many different types of health impacts, though, and an easy one to think about is, I suppose, the effect it has on our most vulnerable, the children, or the paediatric population. And water sanitation is probably the leading cause of death in children under 5 worldwide. And I think every day about 700 children die due to diarrhea-related illness as a consequence of water sanitation. And this is expected to increase, and by 2040, 1 in 4 children will be living in an area of extreme water scarcity. And I suppose with our changing water landscape, we always face this risk of a water conflict. Food security and access to nutritious and healthy food is another kind of important health impact we see here in Ireland. And this can be due to both local and international effects. Immediate things such as changes in our weather patterns will affect how we use the land, the length of our growing season, and then also be impacted by invasive species and pests. And so we're heavily reliant on external sources to provide our nutritionist needs, as you can see here from this graph. And so this places us in a very vulnerable position, not only due to how we are able to self-source and self-provide our own food, but what happens if that food supply chain is cut off. But historically, Ireland has actually shown a lot of adaptation and resilience to changing imports. And actually, during the period of World War II, our food imports trickled to almost zero. And so we actually ramped up our Indigenous grain production at that time. So when the pressure is there, adaptations can be made. And I suppose when we're thinking about the health consequences of this, years ago, I suppose, when people weren't meeting their nutritional needs, we were seeing, people losing a lot of weight, a lot of cachexia, and the health outcomes as a consequence of that. Whereas now we're facing the opposite. We're seeing malnutrition with obesity. So 1 in 4 Irish adults are now considered obese, and 61% of Irish adults are either overweight or obese. And even more worryingly, 1 in 4 of our school-going children are considered overweight or obese. And so this has had a very different consequence in terms of our healthcare delivery and our healthcare system. So our healthcare system faces different challenges then, as both direct and indirect actions from climate change and some of the health impacts I've mentioned. Rising healthcare costs, I suppose, due to the different impacts from particular events, but also overall with the increased burden on our healthcare system. And an interesting study in the US showed that in the period of 2012, they looked at 10 separate different climate events, and those healthcare costs equated to about $10 billion in 2018 money, which is a huge burden, a financial burden on the US. We'll also see changes in equity. So already we see disadvantaged and Indigenous populations not always able to access or meet their healthcare needs, and this will just deepen that divide, and particularly then also the vulnerable populations such as our elderly population, children and the homeless. Healthcare access is an important consideration for 2 different reasons. First, so disruption of the healthcare system can be a physical one, not being able to actually physically get to our healthcare services to actually access the care due to either difficulty, from extreme weather events, or actually then because the healthcare system is so overburdened, we actually cannot get our foot in the door to get the access to care that we need. And this is already a system or a problem that we're facing in our system at the moment, with excessively long waiting lists and a lot of cancellations over the last few years because of COVID for routine surgeries and appointments. And this will overall have an impact on the quality of care we can deliver, not only because of difficulty with overcrowding or an overburdened healthcare system, but also if we face disruptions to our supply chain and also our ability to procure the different services that we need. Staff is also an important consideration. My colleagues have done an admirable job over the last number of years in rising to the challenges from COVID-19. But I'm very aware that we're a very burnt out and overburdened workforce. And, as the years go on, you have to prepare the staff to either be educated and workforce ready to address these challenges, but also to remain motivated. And I think that'll be something that we're going to see a lot of over the next 5 to 10 years. Our workforce will move if that's not met. We see a lot of our current staff emigrating to Australia, and those numbers will continue to rise depending on the challenges that we face. So talking a bit just about the carbon emissions, as mentioned, almost 5% of our national emissions can be attributed just to the healthcare sector alone. And the predominant amount of these emissions are from Scope 3. And Scope 3 is maybe some of the more indirect consequences of our emissions, such as transport, delivery of goods and services, water use, as well as food production. And so, although this is very vast and can be maybe at times a little bit overwhelming, it does provide a huge opportunity. And this trans-sectoral nature is something we need to think about, not just about healthcare alone, but in combination with the other departments and groups in Ireland. And decarbonisation is a very big challenge that we face, but it can be done. And there are examples here that I'll mention now. Our colleagues that we work a lot with, Healthcare Without Harm, they have launched a decarbonisation strategy to enable healthcare systems to meet net zero. And this was launched earlier this year. And from this, they've conducted this it's called the Life Recycle project, where they're working with 9 different hospitals and 2 regional healthcare systems to implement these decarbonisation and resilience and mitigation strategies. So it'll be great to see their achievements and outcomes from this, and can this be replicated at a more global level. I mentioned the NHS here. Our partners across the pond in 2021 made this very ambitious target to meet net zero in their carbon emissions as a healthcare system. And now the NHS is very similar to Ireland. It's got a lot of the same problems, same issues at waiting list, access to care and delivery. But I suppose what we should take from this is that just because a healthcare system is fraught with difficulties and challenges, it doesn't mean that that healthcare system cannot make an ambitious target and implement change. So I'll just briefly touch on two initiatives on this carbon reduction that Irish Doctors for the Environment have made in the last year alone. So our air quality group have made this incredible inhaler or pocket inhaler prescribing toolkit. And this is in an effort to reduce the carbon emissions from commonly used inhaler devices. For instance, the little Ventolin inhaler, the little blue L-shaped one, carries a carbon footprint of 176 kilograms, and that's just one inhaler. But making a simple switch to a round discus, it has about a 98% reduction in its carbon emissions. So this toolkit provides information for pharmacists, doctors and GPs to make simple switches to more carbon-friendly alternative choices, but without impacting patient care. And I think that's really important. And we'll be formally launching this toolkit later on, I think, this month or in early December. And we'd love to hear some feedback on how user-friendly and how people find it. Anaesthetic gases is a huge area of emissions here in Ireland, and our anaesthetic gases working group only just recently published this incredible audit for the work they carried out in 2019, which measured the anaesthetic emissions from 59 hospitals in Ireland and found that this equated to almost 18,000 tonnes of CO2. Now, a huge majority of this is from nitrogen oxide use, and also some other gases such as desflurane, which Philip mentioned earlier on. Although it only accounts for about 4% of the use of anaesthetic gases, it does account for 40% of the emissions. So the results of the audit have been very promising. 4 out of those 20 departments have now ceased using desflurane altogether. And then thankfully a lot of repairs are being made, addressing leaks, for instance, in different hospitals. And I also should mention that of the 59 hospitals, 2 of the hospitals, which were acute care and tertiary maternity hospitals, individually accounted for 1,500 tonnes of CO2. So it's also by looking at which are the heavier players and what can be done to help reduce that. And this has thankfully led to the college to develop the Clinical Sustainability Project with the HSE and the College of Anaesthesiologists in Ireland. And they hope to mirror the ambitious targets proposed by NHS Scotland for zero emissions from nitrous oxide by 2027. So to enable a carbon reduction plan, we first need to measure our carbon emissions. We need to initiate this reduction, and then we need to monitor and regulate it. And this is important so that we understand what our problem areas are and how we can best improve it. Because at the moment we're living in a very unsustainable model of care in Ireland. We have a huge reliance of care provision in the tertiary centres and in our large hospitals. And really we need to refocus those efforts. And if we are to become more healthcare sustainable, decarbonise, and also build on a preventative model of care, this will help reduce the overall burden we have in our healthcare system. So not only will this enable us to be a healthier population, but also a more health system resilient one. And so what do we need to do kind of going forwards? Well, I think that healthcare workers, but also governmental decision makers need to continue to create awareness, not just to ourselves, but also to the public and our patients about these different health impacts. We need to write and implement different policy developments to ensure that these targets and actions that we wish to do are carried out. We need to measure and monitor our carbon emissions from our healthcare system at large. And to do this, we will enable the building of a circular health economy. And by doing all this, we will not only help reduce health inequities in Ireland, we will also build a healthier and resilient healthcare system. So I just want to, I think I'm almost out of time. Thank you very much for listening to me today. And I suppose just finish with a call to action and just ask everyone here today that, you know, what we need to do going forward is not only just create a carbon neutral or a carbon reduction in our plan going forward, but also to work together to carry out these targets. And together, I suppose, we can deliver a very ambitious net zero future. So thank you very much. Oh, yeah.